Foundation Module 5, Use, Modular Integrated Undergraduate Curriculum Physiology. Dr. M. Ashraf Thind. Senior Demonstrator, Sheikh Zayed. Medical College Physiology Department. Founder and CEO of Dr. Sheen Medical Lecture. Superfast Simplified Physiology Video Lecture Notes. Guyton and Hall 14. Edition Chapter. Number 42. Respiration, Pulmonary Ventilation. Lecture Number 6. Learning Objectives. Explain the causes and pathophysiology of sleep apnea. 1. Definition of sleep apnea. 2. Causes of sleep apnea. 3. Pathophysiology of sleep apnea. 4. Types of sleep apnea. Obstructive sleep apnea, OSA. Central sleep apnea, CSA. 1. Definition of sleep apnea. Absence of spontaneous breathing. It occurs during normal sleep. Duration or episodes of sleep apnea, lasting for 10 seconds or longer and occurring 300 to 500 times each night. Or, sleep apnea is a sleep disorder characterized by repeated interruptions in breathing during sleep. 2. Causes of sleep apnea. Obstruction of the upper airways, pharynx. Impaired central nervous system respiratory control. Overweight. Anatomical variation, such as a narrow airway. Enlarged tonsils and adenoids in children. Enlarged tongue or uvula. Nasal obstruction. Congestive cardiac failure, CCF. Stroke, chronic lung diseases, neuromuscular disorders which can affect the oxygen delivery and regulation of breathing. Older obese persons in whom increased fat deposition around the neck and reduce the size of airways. Hormonal factors, such as hypothyroidism, acromegaly. Polycystic ovary syndrome, which can affect the metabolism and the growth of tissues in the airways. Genetic factors or certain syndromes. Down syndrome, Marfan-Sy syndrome. 3. Pathophysiology of sleep apnea. It is an obstructive type of sleep apnea. Pathophysiology of sleep apnea is the study of how sleep apnea affects the normal functioning of the body. The muscles of the pharynx normally keep this passage open for inspiration. During sleep, these muscles relax, relaxation of throat muscles, but the airway passage remains open for proper airflow. Some people have narrow passage and relaxation of these muscles. During sleep causes the pharynx to close completely so that air cannot flow into the lungs, block the airway. In persons with sleep apnea, loud snoring, grunting, and labored breathing occurs. The snoring continue, becoming louder, and then interrupted by a long silent period, during which no breathing, apnea, occurs. Decrease in partial pressure of oxygen and increase in partial pressure of carbon dioxide and stimulate respiration. This stimulation causes sudden attempts to breathe, which result in loud snorts, a loud sound made by forcing air through the nose, and gasps followed by snoring and repeated episodes of apnea. The periods of apnea and labored breathing are repeated several hundred times during the night, resulting in fragmented restless sleep. Patients with sleep apnea have excessive daytime drowsiness, as well as other disorders, including increased sympathetic activity, decreased heart rate, pulmonary and systemic hypertension, and increased risk for cardiovascular disease. 2. Central sleep apnea. In this condition, the central nervous system drive, control, to the ventilatory muscles temporarily ceases. It occurs due to damage to the central respiratory centers or abnormalities of the respiratory neuromuscular apparatus. Decreased ventilation, even when they are awake, although they can do normal, voluntary breathing. During sleep, breathing disorders worsen, resulting in more frequent episodes of apnea that decrease partial pressure of oxygen and increased partial pressure of carbon dioxide that stimulates respiration. These temporary instabilities of respiration cause restless sleep. Clinical features similar to obstructive sleep apnea. Cause of central sleep apnea is unknown, but may be small doses of sedatives or narcotics. It is less than 1% of cases. Note, keep in mind. In some cases, sleep apnea may be caused by a combinations of obstructive and central mechanisms. This mixed type of sleep apnea is approximately 15% of all sleep apnea cases.